If you've ever found yourself lying in the dark next to your partner, heart aching with a silent question, is it me? I want you to know two things right now. First, you are not alone in asking that question. And second, the answer is no. Erectile dysfunction is rarely about your desirability, but the emotional fallout can make it feel that way for both of you. So, my goal today is to give folks the resources they need and the perspective to stop internalizing erectile dysfunction and start navigating it together as a team. And with me, I've got one of the clinicians for modern intimacy, Presley Wilson, who recently wrote an amazing blog providing support and resources for partners of those who are navigating ED. So, Presley, thanks so much for being here with me today.
Thanks for having
Of
me.
course, of course. Let's talk about how common erectile dysfunction is really and who does it affect?
So, research suggests that roughly 1 in 3 men experience some form of ED, and it's affecting between 30 to 50 million men in the US. While societally it is often associated with older age or poor health, its prevalence among young, healthy men does continue to grow. There are many theories as to why that could be the case, but really the most important thing to note there is that this is not an uncommon issue and normalizing how common ED truly is today can be helpful in preventing shame and blame when erectile functioning issues do occur.
In your blog, you talk a lot about how erectile dysfunction affects both partners if someone's partnered in navigating it. What do you think is one of the hardest things for partners of men struggling with ED?
Despite how common ED is, it's never really talked about. So, one of the hardest things for partners can be just knowing how to respond, how to talk about it, and what it really means in the long run about you, about your relationship. It's easy to assume it is a you problem or it's a them problem or find a million other things to blame rather than recognizing how common this truly is and how workable, resolvable of an issue it can be in most cases.
What stands out to me when I'm working with couples around this issue is that there's often this shared feeling of helplessness and fear, right? If we talk about it, it becomes real and uncomfortable, and the discomfort can add to some avoidance or some maybe withdrawal from the process of being sexual together. So I often find that folks tend to suffer in silence around this, using a relational model when someone is addressing ED. What does that really mean in practice? And what are some of the steps that partners can take to help approach erectile dysfunction as a team?
So, using a relational model means viewing ED as something you navigate together, not as a personal failing or something to fix alone. While physically ED is affecting the men experiences, those emotional and relational impacts are shared. So, when an internalization process occurs in partners, that can often lead to feelings of rejection, inadequacy, which only add to the relational or intimate issues probably already occurring, as well as reinforce that physical reality of the erectile dysfunction. When one or both partners withdraw or avoid the topic, recovery is often slower, and research has shown that in many cases. Whereas open communication and collaboration helps both partners move away from self blame and also experience greater senses of agency around what's occurring, which often leads to better outcomes or recovery rates. Three easy steps to go about that are normalize, validate, and communicate. So, with normalizing, acknowledging that ED does happen and it's nothing to be ashamed of. With validating, letting your partner know that you still care about them and understand that this is hard emotionally. And communicating, keeping that dialogue open about what feels good, what doesn't, and what emotional needs are coming up for both of you. These steps can help shift the focus away from performance to connection, which ironically within itself will probably improve sexual function naturally.
Yeah, it feels often really lonely for partners when they're in a relationship and ED is present. Both partners can feel really lonely. So, creating that opportunity for this to be a relational moment does tend to decrease anxiety, decrease shame, and really brings people to a place where they can get more creative together. And that creativity and that non judgment and the collaboration really helps to reduce the symptoms of ED psychologically.
I think he does challenge couples to expand their definitions of sex and intimacy. You do have to move from, instead of focusing solely on erections or penetrations, being open to more forms of pleasure, and broadening those sexual scripts can feel really expansive for couples and leads to new routes towards receiving pleasure, which may have never come about or been explored otherwise.
Can you elaborate on maybe what some of those new forms of intimacy can be?
Yeah, couples can explore sensual touch together, emotional intimacy, and mutual pleasure in a lot of other forms. I think a lot of times we get stuck on penetration as sex when introducing foreplay, introducing aftercare, introducing sensory experiences, whether that's candles, whether that's bathing together, whatever it is, can really start to help you expand what sex means together and how you experience intimacy together.
Yeah, even taking penetration off the table altogether for a little while can paradoxically increase the likelihood that ED will resolve on its own. Because for a lot of folks, when the ED is more psychologically organized, anything that feels like pressure or obligation to have and maintain an erect penis or to perform sexually in a certain way, it can really create this inverse effect of stress and tension. And that is often what someone is navigating as they're struggling with ED. Taking that off the table and focusing on other ways to be in touch together, to be embodied together, to be in pleasure together, sexually or non sexually, without making penetration the coup de grace of the moment or even a menu item, can help couples learn how to touch each other and receive touch in a way that really focuses on enjoyment and pleasure, which sometimes feels really hard to get to paradoxically because when couples are saying, hey, we want this experience of penetration together, it's understandable, but taking it off the table really can actually make more room for it to be possible.
And that again is shifting that focus from performance to connection.
Mhm.
If your goals are more to connect than to have a certain outcome, whether it's an erect penis or orgasm or whatever it is, that can really help.
Yeah, it's a real confidence builder to realize that there are different pathways to pleasure. And when couples work together to find resolve, whether they're working on trying to address ED or any other sexual concern that might be present, that collaboration really makes a lot of space for this to be part of an adventure together and not something that's necessarily a problem, but something that's an opportunity to deepen and, to use your word, expand more solutions and more pleasure and more fun together. So, somebody who's partnered with a person who is navigating ED, and their own emotional needs. How can they take care of themselves while they're also supporting their partner?
I'd say that's arguably one of the most important parts here because acknowledging your needs and staying grounded within yourself and your self worth will help reduce those common tendencies towards resentment and disconnection. With being supportive of someone who is struggling with this, it can be easy to lose touch with your own sexuality and the loving, intimate connection you have to yourself. And that's where self care really becomes crucial. Whether it's journaling to process your emotions, or grounding practices to stay present, or just reconnecting to your erotic self outside of partnered sex, can all really help.
Love that. Yeah, anything that really helps you stay in your own body and stay connected to your own erotic energy and potential so that you're not at as great of a risk of internalizing and making this about you. Lots of partners want to be supportive, but they don't really know where to turn for guidance. What are some options for a supportive partner who's looking for ideas or answers?
So, the blog does list a number of podcasts and books and individual resources, but as we've mentioned, ED often remains a really sensitive topic. So, seeking a couples therapist or sex therapist, whether that's through modern intimacy or other routes, can really help both partners navigate that journey. And directories for where to do that are also linked in the blog.
What's one final message you'd like to impart to partners of folks who are navigating erectile dysfunction?
That this is not your fault and it doesn't define your worth or your relationship. It is undoubtedly frustrating, but with the right support, it can become an opportunity to deepen intimacy and connection as a pair.
Amazing. Thank you, Presley. And folks, if you like this video, don't forget to like and subscribe. If you have questions for us, leave them in the comments below. We'll try to get to them. And Presley's blog is linked in the subject down below.